I don't like dental. The word, your dog needs a dental. That makes the hair on the back of my neck kind of stand up because that's an adjective. It's not a procedure. I compare everything we do in the dog's mouth to what happens in our mouths. Nobody's ever talked to me before about this.
Exactly. Right.
I understand now why this is important. I understand what I can do for home care.
Hello, everyone, and welcome to a special episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
All right. So we have a special guest on this podcast today. We're very excited. One, because February is dental month. And so this episode is sponsored by Tartar, which is really cool. And so I'm going to read the biography here. We'll get right into the episode. All right, here we go. She is a charter member of the Academy of Veterinary Dental Technicians and earned her veterinary technician specialty, so she's a VTS, in dentistry in 2006 with recertification in 2020. She has more than 30 years of experience in veterinary dental research, which makes her an OG, oldie but goodie, just like me, and clinical practice, and is the president of Beyond the Crown Veterinary Education, where she teaches practical systems to help veterinary teams elevate standards in dentistry and core procedures. She was named NAVTA Veterinary Technician of the Year in 2020 and VMX Technician of the Year in 2024. She is also a national speaker, wet lab instructor, and author of Companion Animal Dentistry for Veterinary Technicians. Please welcome Mary Berg to the Veterinary Roundtable. Woo!
Thank you. Thank you so much. Making me feel really old when I hear all that stuff. So.
I know, right? When you read the bio and it's like, wait.
Yeah.
Time goes by very fast, doesn't it, Mary?
Yes, it does. It does.
And when we were both at Western, the conference the other day, you were saying that you had grandchildren, right? And so you have 2 sons. Is that right? Am I remembering that right? And then
yes, 2 sons and 5 grandchildren.
Yeah, that's amazing.
Ranging in age from 14 to 4.
Okay, so fun.
Nice, so fun.
Yeah,
I was gonna say.
I have just the 2 twins. Twins, it's duplicitous when I say that. I don't know how to, I just need to say twins.
Twins.
But I say 2 twins. That doesn't make any sense.
Yeah.
That are
we
also
could have 2 sets of twins.
Two sets of twins, right. But, they are also boys, Mary. So it is all men around me, except for my daughter-in-law.
Yeah,
so, you know what that's like.
Yeah, I gotcha.
Okay, so let's go ahead and get into it, and let's start talking about this interesting topic because I think that it pertains to several clinics, all the people within the clinic, and I think there's so much that information and knowledge that you have to share. So for listeners who may not be familiar with your work, why don't you tell us a little bit about Beyond the Crown and kind of what inspired you to build it and what it's all about and what it focuses on?
Well, my main mission is to help veterinary hospitals do a better job of dentistry across the board and getting the entire team involved in helping them all understand how important dentistry is to the animal's overall well-being. Unfortunately, for many, many years, there was very little dental education in vet schools.
That was
still kind of is very little.
I was going to say,
in technician programs, there's very little. It's getting much better. I now teach for 2 online programs, and I get to teach a dentistry semester of dentistry at each one. So it's getting better, but it's still something that 80% or more of our patients have this, and we just don't want to talk about it, and we don't want to treat it. And so my goal is when I go into the hospital is to have the entire team, from front end to back end of the hospital, to really hear the message of how much dentistry and a good oral health can make their patients healthier overall. And I also then teach them proper techniques. So we're kind of getting away from, some of the stuff I see is not necessarily the best option for the patient. And I want to make sure we're doing it in a way that will help them be more efficient in a dental cleaning, more efficient in taking dental radiographs, how to actually look for disease, and make sure they're just doing a good job for those patients, because that's what it's all about, is to make our patients healthier at the end of the day.
So when I was growing up back in vet school, you're exactly right. Like, we did not, I think dentistry was an elective. That's all that it was. And then when I got out into practice, it was like, does it wiggle? Okay, it needs to come
Yes.
out. Like, right? Okay, he's like, we
Yes.
didn't have dental x-ray. Okay, so maybe it was there, but I mean, that would have been, 96. So it wasn't anything used on a routine basis.
No.
You were taking skull films if you wanted radiographs of the mouth, like going into x-ray and taking skull films. And so it has changed so much in, 30 years. We used to call them dentals or cleanings, and now we've gotten really good at using the word core, like a core procedure. What do you think that does, like changing the language that people use within the practice? Can you tell everybody what a core procedure is and why it's important to refer to it as that?
Well, I actually use a different acronym.
Okay, sure.
So I actually use COHAT.
Okay.
COHAT, which is Comprehensive Oral Health Assessment and Treatment. And I like that over core because core is, I think it's Comprehensive Oral Radiographic Examination. I like the fact that we're doing a comprehensive exam and treatment at the same time. So that's why I like COHAT better. But that's, personal preference. I don't like dental. The word, your dog needs a dental. That makes the hair on the back of my neck kind of stand up. Because that's an adjective. It's not a procedure. We don't say your dog needs a cardiac or your dog needs a renal. We just don't say those words. So, that's why I've always been like, you want the clients to understand what this is all about. We have to use terms that really mean something to them. So, so I'm a big believer in using, COHAT. If you use core, that's great. You could shorten it down to just OAT, oral assessment and treatment. Many of the vet dentists I work with would like to have the word anesthetized in that as well. So whether it would be like an anesthetized professional dental cleaning, something to that effect. So it just is more than just the old, your dog needs a dental.
Right.
And really showing the client that this is why it's taking a little bit longer and why it may cost a bit more than they thought it should.
Well, and you bring up a great point, like as far as like cost more.
Yeah.
You have to establish value for the client, and I mean, all of us, I think it's not too difficult to get the staff to be on board with the dental, like wanting to pursue dental procedures and improve the oral health of patients. But like being able to explain that value to people, and so the terminology that we use, I think that's, part of it in establishing value. I don't know, from a technician perspective, do you feel like that's true?
Yeah.
Like
I do. Yeah. And I'm curious to know how she would verbalize that, because I feel like we could do a better job at
when you're talking about whether or not the pet needs it, or you mean like within the exam room?
Just in general. Like,
well, I compare everything we do in the dog's mouth to what happens in our mouths. And, almost everyone's had their teeth cleaned, hopefully.
Yeah.
And they understand kind of what is all involved. It's just that our patients unfortunately have to be anesthetized because they're not going to sit and hold their mouth open and say, ah. So we do everything that they're going to do in the human dental chair. We are doing a comprehensive oral exam. We're looking and probing each tooth. We're taking a full series of radiographs to see if there's something. And the reason radiographs are so important is because our patients can't tell us where it hurts. And, I tell clients that all the time. I said, I wish I could do this, but, Fluffy can't tell me where there's a, problem in her mouth. And, it just is something that when I compare it to human dentistry, it tends to kind of help a few light bulbs go off a little bit. But I think the biggest thing is really, and this is one of the talks I just did at WVC, was creating and how to present treatment plans. And because it is something that is kind of a fine art in some ways. But to really, this is a technician role. So I'm all about, empowering our technicians. But having them sit down beside the client, not over the table, not across the room, but really beside them to show that you're kind of on the same team with them. And then to go through that treatment plan step by step and explain why each of those steps is important for their pet. And I think that really helps take out kind of some of that fear of, oh my gosh, what are they going to do? And then also understanding the value of what that procedure is going to take to do correctly. So, that's one of the things that that I've always been a big proponent of is that, we really have to explain everything to the pet owner because, you know, I travel a lot and I get
Uh-huh.
people who think, oh, my groomer does everything you do, or, they brush the teeth once every 6 weeks and that's more than enough. And it's like, no, what would your mouth look like if you only brushed every 6 weeks?
Mm.
You know, so, um,
The 1500s back in
yeah, I'm like, oh, I'm good. I'll stay over here. That's fine. So those are kind of the things like I said, I just compare a lot of it to human dentistry, and that helps them kind of understand a little bit more why we need to do it.
What do you think are if a clinic is unwilling to really pursue dental care, and trying to optimize that type of care for their patients, do you see that there's a financial cost to the practice? Like, or what's the financial upside to the practice when they do pursue, optimizing health from a financial perspective?
Well, I think part of it is, and this I even had this happen to me many years ago, but hospitals are losing a lot of what we relied on for income for many years.
Uh-huh.
We don't have the pharmacy as much as we used to. We're sending everything off to, a human pharmacy or Chewy. We aren't doing as many spay and neuters, which used to be many hospitals' bread and butter because of, low cost spay and neuter places.
Uh-huh.
So I think this is one area that there's no other disease in animals as prevalent as periodontal disease. And I want to live in the world where we get to the point where we don't have to treat periodontal disease anymore, but we're doing all prevention for our patients so we don't get to those dumpster fire mouths.
Uh-huh.
And I think that's one of the things that hospitals have to understand is that we're not getting that income. And here is something that, 8 to 9 out of every 10 dogs that walk into your hospital have.
Uh-huh.
We really need to know how to do a better job of this, how to make it more efficient, get more I break it down by the grades of perio disease. So grade 1s, get more grade 1 and 2s in. It doesn't take us as long to do them. We can keep those costs low. We can do more in a day. And then hopefully we get to the point in our lives where we don't have to, have those 3+ hour procedures of a grade 4 where we're doing multiple extractions
Uh-huh.
and the animal is just unhealthy. I think another, that's just one of the things I think hospitals have to understand because unfortunately, I haven't seen the data in the last year or two, but when you look at what percent of income for most veterinary hospitals comes from dentistry, it's still under 10%,
Uh-huh.
which is so sad when you think about, how many patients have the disease.
Allie, what's
So-
ours?
I don't know, but I was like, wow, that seems really low. I was
It is really low.
Allie is the head surgery technician at All
Okay.
Star, and so that's
I
why I was
feel
like
like-
grilling her. Like, what is it,
I
Allie?
feel like
What
ours
is
is
it?
higher than that. Like,
You're gonna
It
have
may
to go.
be. I'm talking average. I'm talking across the country. So,
But that, I could definitely see
yeah, I
how
can
it
see
would be
that. But I just
Absolutely.
feel like that's like what runs our surgery department,
our dentals.
our
Yeah.
dentals. We have them every single day.
Your,
Yeah.
your what? Excuse me, your what
The core
procedures?
procedure.
Thank you.
Yeah.
Okay.
Yeah. Okay. Thanks. Good job, Mary. Way to catch her.
I broke up in a little sweat there for a minute. Okay, got it. I'm okay now.
Yes, core procedure.
I'm
That's all right.
embarrassed. I don't necessarily know this number. What percentage of pets have disease that needs to be treated?
Well,
You're
depends
saying
on which.
8 to 9.
Yeah,
patient.
it depends on which study you read.
Okay.
Anywhere over 80%, and it's probably
That's
closer to 80 to
crazy.
90% have some stage of perio disease,
Uh-huh.
which can just be gingivitis,
Uh-huh.
which is still stage 1.
Uh-huh.
So that one is reversible. If we can get in early with a good cleaning and get that client on good home care, we can take that grade 1 back to a 0.
Uh-huh.
But once we start having bone loss, which we see in the stage 2, 3, 4s or grade 2 through 4, it's really hard to reverse it. There are products coming out on the market. Some of them I'm really excited about that can help regenerate bone.
Uh-huh.
But it's not going to be, it's reversible to a certain extent. Let's leave
Sure.
it at that.
Sure.
It's going to become reversible to a certain extent. But the goal is, for me is to be like, I go to my dentist every 6 months. I want to prevent perio disease. And, with our patients, I would love to keep them all no more than a grade 1 and,
Uh-huh.
a quick cleaning and they're up and ready to go. I think one of the biggest things that I find hospitals do is they may do a lot of cleanings, But if they're not cleaning properly below the gum line, they're not really doing that patient any good because that's where the disease lives. Yeah, they could have gorgeous looking crowns and their teeth look white and beautiful, but the disease is below the gum line. So we really have to have our teams trained on how to use the proper equipment below the gum line to make sure we're killing all that bacteria and flushing it all out. And then if there are periodontal pockets present, we're treating them in some way before we have to do the extractions. So,
Yeah, absolutely. Do you feel like hospitals that pursue the core procedures that they end up with better relationships or bonding to the clinic, like meaning that the patient and the client stay with the, like there's that relationship that ends up getting formed over time?
I think if you do it right, you
Yeah.
definitely can.
Yeah.
I know in my years of practice, I had clients who were telling me nobody's ever talked to me before about this.
Exactly. Right.
I understand now why this is important. I understand what I can do for home care, and it does take that technician to really have those conversations about the things we can do at home and how to prevent these how to prevent disease from progressing on our patients. I always told clients that I'm a huge college basketball fan. And, so I'm like, it's, not a one and done. Okay. You are going to have to do this over. And, we prefer it every year. But now if you do a really good job at home care, maybe we could stretch that out to 18 months, kind of helping them put the ball in their court, so to speak. Because I want them to do what they can at home. Not all patients that's going to work on. Some animals, I think, I always joke that like papillons are born with perio disease. So just start them in utero, getting their teeth cleaned. It's a
Right.
good idea. But some of them we can make that last longer for the client. So, words too, like I was getting, talked a little bit about the term dentals. Another thing I will tell clients when I'm talking to them about oral care is that they have a painful infection in their mouth. People don't understand periodontal disease, but they know infection. And that's what periodontal disease is. And I often tell, when I'm talking to teams and talking to groups of attendees at conferences, I say, if you took all the gingival tissue off of a dog about the size of a Labrador, it would be the surface of the palm of my hand. Now, can you imagine a pet owner not demanding treatment if that infection was anywhere else on their pet's body? So if it was on their side or their hip or the chest, they'd be in going, you need to fix this, doc. But because it's underneath the mouth, we don't talk about it. And that's where it's affecting all the time, the kidney, the liver, and the heart, and causing issues systemically. So a lot of times I'll use that analogy with pet owners as well, just to really help them understand that overall, your pet's going to be healthier if we can get this mouth cleaned up.
No, that's good.
Yeah.
So if a practice wanted to improve compliance with their core procedures starting tomorrow, what would be the first step?
Compliance is really, I think the biggest thing is explaining the procedure thoroughly to the pet owner and why it's important. And that's why, like I say, going through those treatment plans step by step so that they understand why they need an IV catheter, why do we need to take radiographs, why do we need to do subgingival curettage, all of those things to really help the pet owner understand it better. And I think that is the number one way to get compliance tomorrow. So, might take a few days on a couple other things to do, but that would be the number one for tomorrow. Thank you for no pressure. We're going to do this.
So shifting towards like a team atmosphere here. So what is a clear, repeatable workflow for core procedure? What would that look like for a well-run hospital from like check-in to check-out?
Well, I'm a big believer that the check-in should be done by a technician, preferably the technician who will be doing most of the procedure. I think that just is kind of gives that continuity to the pet owner to feel a little bit better. But then if the pet was on medications, did they get their meds? Were they fasted? I'm not a big fan of adding procedures to dental procedures, but you got that lump removal we're going to do at the same time. Know exactly where that lump is, so we're making sure we're treating that. And then after that, I think we're getting them doing a conscious exam before we start with any kind of induction. The reason I want a conscious exam is I want to see how the teeth fit together so we can assess occlusion before I have an endotracheal tube in their mouth. Because once I have that endo tube, I can't do anything else. Once they're induced, on anesthesia and everything is, hooked up, even during intubation, I'm going to check the back of their throat and their oropharynx to see if there's anything abnormal. Then once they're, hooked up and we got the warming devices on and everybody's, and they get to a surgical stage of anesthesia, then I'm going to recommend taking your radiographs then and there. And the reason I want to do those first is then while I am as a technician, am charting and starting to clean, my doctor can be reviewing those radiographs. And then if there's something they see on the rad that they need to call the pet owner with, we aren't wasting time waiting for that phone call to happen. So rads first, then I do charting first. I want to see what the gingiva is like before we're traumatized by cleaning, which will be some trauma to the gingiva. So I want to see what the gingival health is. Then I'm going to clean crowns and below the gum line. I will go back post-cleaning to see if I changed any pockets. Okay. And then I'm always going to check too, before I start polishing sometimes, I will use a black light to disclose plaque and tartar. It will glow bright pink with a black light under UV light. And then I polish. And then if we have any treatments we need to do, if there's any perioceutics or any pocket filling and things like that. Now, when it comes to extractions, that is kind of doctor preference on when they want to do those. I personally like to at least clean the teeth a tad bit before they're taken out, unless they're the ones that fall out on intubation.
Right. Yeah.
But
Allie just had one of those today.
Yeah. The only reason I like to do that is we're kind of creating a wound, right? When you're doing an extraction. So you don't want a dirty wound any more than you need to with the mouth. The mouth is already a dirty environment, but I want to kind of get those teeth a little bit cleaned up. Not perfect, but at least the giant chunks of calculus off and things before we do an extraction. Just because I just don't want that wound to be any more at risk than it needs to be.
One of the things that, as you were sitting here describing like the process, which is pretty much what you guys do as well. The blacklight thing's interesting. You should play around with that. Were you thinking that when that's not something we do? I'm like, you should totally look at that. And see
you can get little black lights. I'm going to see if they show here, but like this on Amazon.
Yeah.
Under $10. They aren't the best. But they kind of turn it more pink or more orange than pink. The Hills lamp or light that they gave us, back in the TD days, this little thing, best light ever for UV.
Okay.
I am really working hard and trying to find somebody at Hills that remembers where they got these, because I would like to actually buy them and rebrand them with my name on, or my business on, and sell them that way, because they're such a good light. I actually have an entire box over here on my shelf of UV lights that I have bought, trying to find one that's as good as this. But that's a great idea, and it's a great tool in the exam room also. So if you get them, in the exam room, you can kind of turn the lights off and turn that onto the dog, lift the lip and turn it in there, and the owners get to see, oh my God,
oh, that's a fantastic
there is that much
idea.
stuff in there. So that's another great way to gain compliance as well, just to kind of give them the you factor.
Oh, absolutely.
Yeah, it's really kind of fun to do. You can also use it on children, but I'm not going to judge that.
I am not doing that to my child. I will be like really mad, I'm sure.
Yeah.
Okay, so what do you think? What's your opinion about spay-neuter clinics or low-cost clinics that are doing dentals and not radiographing mouth? They're just, do you know what I'm saying? Like, right? That's what's happening here in our area.
Yeah.
So we have, a low cost, oh my God, I can't talk.
Low cost.
Thank you, Allie. That does dental procedures, and they don't do extractions, do they, Allie?
I don't know. I think some of them may, but it's like back in the day, like, oh, they're wiggly. This one's got to come out.
We have clients then who are comparing those dollars that they spend to what it costs for a well-performed, with a very well-educated staff, procedure, and it's definitely different. The pricing is definitely different. But they're just seeing two, products that they're comparing apples to apples when really it's not. Why is that happening out in the why are people doing that?
I see it all the time, and part of it is lack of education across the board. That I still see veterinary clinics who don't have radiographs, who don't clean below the gum line, who and they're charging fairly substantial amounts for these procedures. And I think it's X-rays are expensive, X-rays take too long, and I'm like, well, then get your team trained, because I never tell a clinic when I go in how long a set of dental X-rays should take, because I feel like that's setting them up for failure, because I know what I can do them in. Okay, but I've been doing this for a minute or two, and but I'm always like, it takes as long as it takes, but you're going to find up to 42% more pathology taking a radiograph than you ever are going to do on an oral exam. And I can almost guarantee in many of those kinds of situations, they're probably not even really doing an exam. They're just looking to see what's loose and popping it out, or what moves when we scale it. And unfortunately, that's not really doing the pet any justice. One of my really good friend of mine who's a vet dentist will say, debris left is disease left. So you're actually leaving that disease in the mouth. The teeth look better. You may not even get rid of halitosis or malodor, because that's coming from the black pigmenting bacteria below the gum line, which is producing something called thiols, and that's what gives that stinky breath. But it looks better, and it's an easier adoption process. One of the organizations I'm on a board of is the Foundation for Veterinary Dentistry, and we have what's called the Make Me Smile program. And every year, the foundation awards, I don't want to call it a scholarship, but actually a training to shelters across the country. And it's usually somewhere between 2 to 3 shelters across they all apply for it and see who's going to win it. And then we go in with at least one diplomate in dentistry and one BTS in dentistry to spend the day teaching their teams how to do better dentistry. And, how to do the things they need to do. And sometimes they even get some reduced cost equipment to really help their practice do better. It is hard. I had a practice, in another town near me when I was practicing that, did all dental procedures for $105. And clients thought it was exactly the same as what we were doing. And I'm like, no.
Yeah.
And I actually created, I didn't create it. I stole it from a friend of mine. I'm going to be totally honest with you, but we had a brochure that explained, the comparisons. So if you're going to call around to get a price, cost price, whatever, price check, here's what we do at this hospital, and here's what you need to ask them if they're doing at their hospital. And then on the inside of this brochure was why every step was important. So, we have people, they do exactly the same thing you're doing. And I'm like, no, they don't.
No, they don't. Right.
Placing a block. They're probably not cleaning below the gum line, and I know they don't have a radiograph machine. So,
right.
You're kind of having to counteract that a little bit, and it's tough. It can be hard because clients don't know the difference. They assume that every veterinarian practices at exactly the same level.
Yes.
And we all know that may not be true.
Exactly.
So,
yeah, absolutely.
Have you used CT to look at dental images?
I have not used it myself. I've been at hospitals that have used it. Our local specialty in Kansas City has one, and I've done some studies over there, and they were using the CT scanner. I have CT scans of both my dog and my cat who have been there. And I look at it and I just look at the vet and I'm like, I'm glad you're reading that because I don't know what you're looking at. But that's awesome for you. But the 3D image that you get at the end of it is really kind of cool, but also kind of creepy. If you're at dog's head or cat's head. But I think it's something that I just don't know if I feel general practices need that at this point. I know I hear sometimes a GP will say, I'm just going to go get a cone beam CT and not worry about a radiograph machine. And it's like, you need both. Okay. Even the diplomates will tell you need both. You can't always tell everything on this. You can probably see more things on the CT, but there's also some stuff that you really can't differentiate unless you're looking at it at a radiograph.
Mm-hmm.
So I think the two go hand in hand. But I don't think it's something that a general practice really needs to have at this point.
Well, Allie and I
But-
were talking about that, and we were like, even for like extractions, like if you wanted to verify, like the radiograph is going to just be much faster to boom, take that
Faster,
image.
you don't have to move the patient.
Right.
Yeah, you don't have to put them in the, in the tube and all that kind of stuff.
Right.
But I think, and there's a system out there that's called the panoramic X-ray for dogs and cats. It's not very diagnostic in my book. So yeah, it's fast. You just put them in there. It does this little zoom, zoom, zoom.
Yeah.
But I don't think it's a diagnostic X-ray at all. So
Okay.
How do you create buy-in from the entire team and not just the medical director for core procedures?
actually, I can tell you this: the medical director is usually the hardest to get buy-in. I'm just kidding.
That's probably true. That is probably true.
In many hospitals, it can be. We have the old. We've always done it this way, and worst birds in vet med. I think it really helps to share cases. When I come into a hospital, I often share stories and cases of patients I've dealt with, to kind of show them. But one of the things we did, especially, we had a couple, CSRs that, were kind of on the fence, and they're the ones you really need to have understand it, because they're the first and last defense of your hospital, right? And they're the ones that are going to make or break, because the owner's all going to go up there and say, would you do this crazy thing that, this person in back told me I need to do? So a lot of times, some hospitals, I'll say, maybe do a dental procedure on their pet at a, substantially reduced cost. Okay. And then when they see that dog become that puppy again in 2 to 3 days afterwards, like we all know, we've all heard that, right? The dog becomes a puppy again, and they can be then your biggest cheerleader, because now they know they saw the value themselves. That's one way to do it. I think too, a lot of it is just continuing education for them. And when you offer these types of trainings and education for the entire team, not just the vet, not just the credentialed technicians, but the entire team, they feel valued too, because now they're like, oh, I'm getting the CE too. So, but they have to really, have some education so they can have the buy-in. Probably
So much right now going around is people talking about pricing and everything's so expensive in veterinary medicine and da-da-da-da. And, how do you expect, like one of the comments I had the other day was, how do you expect a CSR or a technician, maybe a veterinary assistant, to talk about something that they themselves can't even afford?
It's tough.
It's
hard.
And it is. It's very hard. But at the same time, I feel like this happens all over, not in veterinary not just in veterinary medicine, but just in industry after industry, where you have somebody selling something that they themselves would not partake in. You have a Porsche, like a Porsche salesman,
a jewelry salesman, or
a jewelry, exactly. A Porsche salesman is selling a Porsche. He sees the value in, it doesn't mean he can afford it. Yeah. But how do you talk about pricing and those types of things especially when, like, say Allie's a supervising technician, she's training those below her. How would you advise people to talk about pricing and those types of things?
Well, I think part of it too is we have to help them understand that they probably have a bias going into that treatment plan explanation, because they know it's expensive, or they feel it's expensive. And you're right. I mean, they may not be able to afford that themselves, but they have to understand the value of it. So that gets a little bit tricky. And we have to understand that sometimes we may perceive something as very expensive. The client may not. Just to be aware, my husband's favorite expression is, don't x-ray their checkbooks, because you never know what they can afford. But it is something that we have to kind of get over that bias ourselves, because we can inadvertently project that into our discussion about the treatment plan, even though we don't realize we're doing it. could be, subliminally and all kinds of other messages. But I think too, one of the most important things that I want to always recommend to hospitals is to make sure we're offering some type of third-party payment plan options for these procedures because they are expensive. And whether that's Care Credit or Scratch Pay or Cherry or whatever one is out there, making sure we're offering that to the pet owner helps them feel a little bit better and encouraging them to get insurance. Pet insurance will often, help with the cost of this as well. But it is a difficult conversation. And, in the talk I just did this week, the statistics, yeah, I can say words too. The statistics that I shared said that about 58% of veterinary professionals just dread having to talk about money.
Oh, yeah.
And
I don't
it
doubt
can
that.
also make us extremely anxious and, upset and even angry that we have to talk about this with them. And, and I asked the audience, I said, when's the last time you guys got an estimate on a medical procedure you had done for yourself? And you just don't get them, right? But it is something that we have to really do some coaching, I think is the best word I would say, to our team to really help them feel so that they understand the value themselves. They have to understand why it costs more money. But then also coaching them on how to actually do those presentations so that they're giving the good information without, sending subliminal messages to the pet owner.
I love the idea of talking to them about their own bias because I never think of it from the perspective of someone who doesn't have as much money and their bias on spending. Like you always think of it like the person that has money and then they're biased against,
Right.
I've just never even thought of it that way, that's something that you could project on then,
I could totally see it.
Yeah.
Like sometimes going through an estimate, you're like, and this costs this amount.
Right.
Well,
Right.
yeah, I mean,
Like dancing around the end factor of how much it's going to cost.
One little trick that I do when I do a treatment plan, and I know this is kind of corny, but I've done it for years. But when I'm presenting the treatment plan, so I have the paper there, and I have my hand, and I'm using my finger at each line item. Why do we do this? Why do we do that? But strategically, the palm of my hand is over the bottom number. And then by the time I get done explaining everything, and I show them that number, they're like, "Oh my gosh, that wasn't as bad as I thought it was going to be." Because whether or not your PIMS allows you to have everything priced out, or I would actually prefer to say this is the procedure and this is what's all included in the procedure and then a number at the bottom, but depends on how your PIMS works. I can see people and they're trying to do, how fast can I add these numbers up in their head, right? They're trying to do it, right?
Yes.
But they're like, "Oh my gosh, that wasn't as bad." Or I have gotten called, "Well, she thought she was cute keeping her hand over that bottom number." But, you still went for it, didn't you? But it's a little bit of those mind games. I don't want to say mind games, but
psychology. Yeah.
Psychology. Another little thing that I do to help really show value, and I talk about this all the time, is that there's two words that I don't like to use in veterinary medicine. But the first one I'm going to say is instead of giving them a recommendation or even a treatment plan, I would put prescription for a core procedure on the top of your treatment plan. When you use that word prescription, even though you're not going to go get it filled at Walgreens or CVS, it puts a little bit more, "Oh, I really need to get this done because now I have a prescription for this." So I know my human doctor did that to me all the time when, I was kind of like, I don't really feel like going and getting a mammogram again this year. So on the top of the information, she put a prescription for a mammogram. And I'm like, oh, I guess that means I need to do it. I know that's really a weird way of doing it, but it does tend to change a little bit of the psychology. The other thing that I always say this and talking with people like you, Dr. King, and other ones that are out there doing some really cool stuff. I may kind of do this pretty soon, but I keep saying I'm going to write a talk and it's going to be entitled, "We Need to Stop Shooting All Over Ourselves in Vet Med." And the reason is that we never come out and tell a client what they really need to do. We always say, you should consider getting your pet's teeth cleaned, or you should consider putting your dog on a diet, or you should, instead of saying you need to. And I've been saying it for years, but a couple of years ago, I was sitting in an airport on a delay. And I usually never wear anything vet related when I'm flying because I don't want to hear
Yep.
all the, you just kind of like, I sell shoes, just leave it alone. But, I happen to have my gear on that day, and this woman's sitting next to me, and she goes, "Are you a dentist?" Because I always wear teeth earrings when I teach. And I'm like, "Well, no, but I work in veterinary dentistry." And she goes, "Oh, can I ask you a question?" And I'm like, "Oh, here it comes." "Sure." And she goes, "Why will my veterinarian never tell me that my 13-year-old Chihuahua needs his teeth cleaned?"
Oh.
And I looked her in the eye and I said, "Your 13-year-old Chihuahua needs his teeth cleaned." Like, I haven't even seen your patient, but yes.
Yes.
And we started chatting a little bit about it, but because they never come out and actually say it. And I'm like, "Oh my God, I want to use you as my poster child from now
Mhm.
on, because I'm going to discuss this conversation we've had in talks that I do, because, I've been saying this for years, but now here is a client I didn't know from Adam who
Mhm.
just told me this in an airport,
Mhm.
and, so it's something that really I think our clients want to hear as well, because, they're counting us to be the experts. They're counting on us to really know what needs to be done. And when we say should, or even just, I recommend this, is a little bit less strong than giving them a prescription or you need to do this. So just some of the things that I've been talking for years about on ways to really help gain that compliance is clients want to hear those things.
Yeah, one of the tricks that I've picked up on over time is to stop talking about cost, like, so comparing the price of things, and start talking
Mhm.
about what something's worth.
Yeah.
So, for example, it might be like, it's worth your, not smelling the breath anymore, right?
Yeah.
Like not having bad breath and having to, when your dog comes up to greet you and not having to be like shy away from it, like
Yeah.
that's worth something. It's worth something to not have to have kidney disease or to worry about kidney disease or cardiac disease, or, your pet getting you up in the middle of the night to go to the bathroom because now we have a UTI, whatever it might be.
Yeah.
All of those things are worth something.
Yeah.
And so those themselves have a price associated with them.
Yes.
And so talking about that versus, comparing
Yeah.
things via price has always been
I think
helpful too.
I think that's very true. I mean, it's worth it to not have your Chihuahua be head shy
Right?
because their mouth hurts,
Exactly. Yeah.
and,
Mhm.
how many Chihuahuas, I can't even tell you how many I've dealt with over the years that were so head shy. And when we finally did, unfortunately, the whole mouth extractions, because that's what they needed by that time, the owner, the
That's what
owners
she
are
just
like,
did today. She had
yeah,
that procedure today. Yes, with the
the owners will tell me that, "Oh my God, they're letting other people in the family hold them now,"
Oh,
you know?
wow. Yeah.
And and I share some of those stories with pet owners too, who are like, "Well, I just don't know." And I said, "Well, let me tell you about, this 3-year-old Maltese that we saw, and, and how much better it felt afterwards, and how the owner actually asked me to put the teeth back because he thought he had a really sedate dog." And I'm like, "No return. Sorry, dude." But, I mean, it's those kinds of things, it's so sad to me when I hear somebody tell me, and when I was in practice, it said, "Oh my gosh, he's just getting old." He's
Mhm.
5. He's not old,
Yeah.
he's not old. you know?
Oh
So,
gosh.
yeah, it is something, but those are just some
That's
of the things that
funny.
I like to talk about.
Question for you. Let's move
Mhm.
on to some of the
Yeah.
maybe take things that recommendations for clients as far as products and things like that. Do you
Okay.
have some specific take home methodologies, plans that you like to give people when they've completed the COHAT
Procedure.
procedure and now they're going to go home and they're going to do their best to
Yep.
maintain the dog's mouth at home? What are the things that you like to talk to
Well,
them
first
about?
of all, I like to have that again as a setup technician appointment for
Mhm.
discharge, so that we have spend time with them before the pet comes forward, talking about home care. Um, I I wish I could say that I actually recommend toothbrushing on every patient. Unfortunately, less than 2% Americans probably actually brush their pet's teeth, even though we know it's the gold standard.
Mhm.
My little girl who's laying over here looking at me why I haven't let her outside yet is I don't unfortunately brush her teeth. I'm never home.
Mhm.
But she is a 7-year-old terrier with a grade 0 mouth. So what I'm doing is working.
Mhm.
Um, but a lot of people would rather do something like, treat their pet, right? Give them a treat. I'm a big believer in a dental diet. Actually, in my research days, I spent over 7 years testing Hill's TD. I know that product works. I probably did, out of the 700 studies, close to 500 of those, graded that many myself over the years. I know the product works. We actually sent that home with many or almost every patient that could eat it. Sending them home with multiple options for treats in like a goodie bag so that they can find out what the pet is going to eat is a good idea. I love the Tartar Shield rawhide treats. Gosh, my dogs, my clients loved it. My patients loved it. My dogs love it. But it's a good treat because it's not only a consumable rawhide, but it is coated with a product that's going to keep the calculus from forming, the plaque from forming into calculus. So, something like that. And people have to understand that, yes, it's going to disappear like that. I mean, these guys like inhale them sometimes, you feel like. But the product actually stays in the mouth for quite a while after they've eaten it. So things like that. I mean, there's other treats. There's things that are on the VOHC website, the Veterinary Oral Health Council website, that work in the oral cavity. I am not truly a huge believer in some of the water additives and things like that. I always want to make sure pet hospitals are advising properly when they're recommending a water additive, because not all animals will drink it. And we don't need that cat who will sit there like, I ain't touching that bowl. You put something nasty in there, and I'm not going to drink water for 4 days, and now I'm in renal failure,
That is so true. Yes, absolutely.
Yeah. And we have to make sure that pet owners understand they have to kind of measure it. They have to change it every day. You can't let it, sit for 3 days before you change the water bowl. Can't run it through, like a filtered water, like a fountain, because the active ingredient will flush out with those things. I think there's just, my philosophy is sometimes if it sounds like it's too good, probably is, I don't, I think a water additive or a sprinkle, if that's all the pet owner can do, it's absolutely better than nothing. But I think, I'm a big believer in mechanical action for removal. So yes, if I'm going to talk toothbrushing, I'm going to demonstrate toothbrushing to them. I'm not going to just hand them a toothbrush and a tube of paste and say, have at it, without talking about and giving them, resources on how to do it and that it takes time. It could take 2 to 3 weeks before your pet will accept it readily. I also like some of the wipes that are out there now. There's some really good wipes and for some reason people will wipe the teeth before they brush. I don't know. I'm not going to try to be a psychologist and psychoanalyze, but there are ones that will do that. And, so when I put that goodie bag together, I really like putting a toothbrush in there. Okay. And, I get the toothbrushes. I'm not going to go, I actually just buy pediatric brushes. You can find them online, and I have the clinic name typed into the handle, and they're just soft bristle pediatric brushes. And then we put those and toothpaste, a sample of toothpaste or so in every bag. And then we put in some treats and, whatever else, maybe, some of the wipes come in a little 10-pack that you could put a little 10-pack of the wipes in them. Things like that in a goodie bag for the pet owner to have some options at home when we talk about how each of those works. Then I also recommend having a follow-up visit in a week or two, whether or not there was oral surgery done or not. But if there were extractions, to check them out and see how they're healed, but then also to find out how the home care is going. Is this something that, your dog likes? And if the dog just had 18 extractions, I don't want them in that mouth brushing. I don't want them doing anything for a bit. But how are things going? What's happening for you? What can we do? Maybe we need to change some things up. I explain what's a safe treat or what's a safe chew and toy. The dog's jaw doesn't go side to side, so we can't give them that bone to chew on, and that's why we have so many fractures on those teeth. Explaining all those things to the pet owner, and that really helps bond, I think, that client then to your hospital, because now they know that you care.
Right.
There's that old saying that said nobody cares how much you know until they know how much you care.
Right.
And they know now that we care about their pet and we want them to be healthy. So I'm a big believer in choosing diets, bottom line,
Yeah.
I'm not a big fan when I hear clinics that just say, oh, we just give them a copy of the VOHC list and say, here, have at it. I'm going to, at least star or highlight my favorites on there. You know what I
Right.
mean? So,
Well, people are just so busy nowadays, like to have to go find it, and then is this going to work?
It's just like, try this. We have it here at the hospital and give it a shot and see.
Right.
But yeah, I mean, I think it's, my little terrier over here, she's a living example that, feeding TD and a good dental chew every day will keep her mouth at 0 at 7 years for a 14-pound Chihuahua, not Chihuahua. Oh God, did I just call you a Chihuahua? Oh Lord, I'm sorry.
And
Jack Russell.
I was with Tartar Shield at their booth at WVC, and we were talking about the new toothpaste that's been VOHC approved. And so I know you probably know this information, but I'm going to share it with you, Allie, because it's so cool. And I don't know if I necessarily understood until I heard Nathan talking about it. But it does not rely on the mechanical brushing to reduce plaque. And their studies side by side show like a 27% reduction in plaque and tartar buildup. And so, whereas the older toothpastes had their, how they feel gritty?
Yeah.
They rely on the mechanical brushing, which is why the dentist back in the day was like, I don't really... Like, I care what toothpaste you use, but really it's just the brushing, that's going to make the biggest difference for you. And so, anyway, I thought that was really interesting. And it's, so when you feel their toothpaste, it's more like a film.
Super creamy.
Yeah, it's like
it's very creamy.
And they did the study with just the finger. They just put the toothpaste on the arcades, on all 4 arcades, and then measured so they didn't even brush it on. So it's I think it's the only one like that. Am I right about that?
Well, they're the only ones that have their ingredients. And off the top of my head, I'm, still on Vegas time, so my brain is fried right now. I can't remember the exact ingredients in it right now. There are ones that have said enzymatic action. I've never been always 100% sure. I felt that they did as much as they could. But, I'm one of those people for years, and having been in research for 13 plus years, plus still doing research now, we did for years saying brushing alone with water is as effective as any toothpaste out there, because we couldn't put the stuff in dog pastes that we can in our pastes, because the dog or cat has to swallow it. We don't. So we can't have the silicates and the fluorides and all the other stuff in it. So yeah, for the most part, brushing was what did it. But the toothpaste tasted good, so the dog wanted to have it done.
Right,
so
exactly.
That was kind of it. Yeah,
they were very flavor heavy, or what I think is how it's described. So
who doesn't want their teeth brushed with chicken flavored toothpaste? Me, okay, I
that's
don't,
right, exactly.
But it makes it more enjoyable. So, so I'm kind of excited about that product because it does help. But I think too, and I'm always a believer in 2 products for a pet owner.
Absolutely.
Offer them 2 things, because maybe they can do that, ProCare toothpaste. Is it ProCare or Pro Enamel? ProCare, I think.
Yeah.
Yeah. If they can do that, I have some here on my desk. I should just look at it. But if I could do that almost every day, but then I'm going to go out of town over the weekend and the pet sitters here, they can then give them a chew those days. You know what I mean? So there's always that option, and it's not bad to do both. The chew and a toothpaste. So making sure that we're doing what we can to keep that patient healthy will be, as best as we can. And we still need to make sure they know that it's not one and done, and we still have to clean their teeth.
Absolutely.
Yeah. So I'm just curious to know, how do you structure? So we have discharge instructions that basically is the same for every patient. How would you structure your discharge instructions to make sure that you get the most information to the owner after a procedure?
Well, you go to my website and you download my discharge appointment form.
Well, I guess I'm going to have to do that. That's
we're
easy
done.
enough.
And we're done.
Because I just feel like we've had super generic ones, and I feel like they could definitely...
is, I used to have one that was like in a 3-page, trifold brochure, and I keep it short. People don't read. Make it bullet points, because people aren't going to read. And the one I have on there is actually customizable to, the patient name and date, when they could start feeding a hard diet or if they should be on a soft diet. You can there's a place in there to re-put in the medications if they're on what meds you're sending home. And then I also have like a little diagram of the oral cavity so that if there were extractions, we can put them on there because people aren't going to look in their dog's mouth. They're all afraid to look at it. So, they know if that extraction was, upper right side or lower left side. And then, there's just some opportunity in there too for some of the frequently asked questions about home care. So, it's just a one-page form. It's nothing, too dramatic, but I actually went during those discharge forms, we went through each step of that discharge with them so that, yes, I'm going through it, I'm talking about it, but we know they retain probably 20% of what I'm saying, but now they have that form that they can go back and look at. So I keep it simple. I have seen hospitals that send home, like a 15-page discharge form. And I'm like, nobody's going to read
Nobody's
that.
gonna read that. Yeah.
No,
Yeah.
or they use the same form for dentistry that they do for a spay and neuter.
Mm-hmm.
And they're so different. We need to really be, customizing those a bit. So,
Absolutely. Okay, well, listen, as we wrap up here today, I have to as you noticed, two of our people aren't here today. One fell sick and she's pregnant and is having a very rough day. Our other doctor, Dr. Duckwall, was got stuck at work. And so but the one technician wanted us to ask, on a lighter note, how do you feel about dogs getting braces and what should practices consider when clients ask about orthodontic options?
Okay. Well, actually, you can put braces on dogs.
Oh my gosh. Okay. Yes. Okay. Tell us more.
All right. But I have a couple things. Okay. First of all, we don't put braces on dogs to give them a beautiful bite.
Okay.
It's to give them a comfortable bite.
Okay.
Okay. Number one thing. We do orthodontics for comfort. I am a big believer that if we are going to do any kind of braces or orthodontic work, that we probably should have that pet altered because I don't want to breed that trait through. That's how we got Frenchies. Just going to say.
Yes.
Say that out loud, but you heard me.
Yeah, it's okay. You can be on the Frenchie bus with me. It's fine.
And, but yeah, well, there's a lot of things we can do. And even general clinics can do what we call interceptive orthodontics. So, don't wait for that deciduous canine to be loose before removing it, because having the two together not only can be a nidus for periodontal disease infection, but it can also cause a malocclusion. It can cause like a bottom canine to be base narrow. There's, we have a saying in vet med that say no two teeth should, occupy the same location. And I actually like analogy I got from Dr. Johnson, who's a vet dentist, who said no two people should wear the same turtleneck. And that's the same principle right there. So getting those deciduous teeth out early. If there's a tooth that causes some, concern, like maybe lanced canines that are going forward and it's just causing issues, you could remove those canines, or because maybe a dog has just a slight underbite and the third incisor is rubbing on the bottom canine, we'll take out that third incisor so it's more comfortable. Brachycephalic dogs, I always like to start that conversation early in that pet's life, that when we do our first dental procedure on this pup, we probably should remove one or two of those super rotated, overcrowded premolars on the maxilla to give more room so we don't have that deep infection that can happen. And I compare those things to people who've had, everybody knows somebody who's probably had to have braces who had to have teeth removed for overcrowding. Okay. So it's kind of like the same thing we're doing in people to reduce that overcrowding to give them a healthier mouth. So yeah, I believe in orthodontics. I don't always, there's a few times I had a pet I probably would have had I had a dentist here when we had her, that I would have put a ball in the kind of the chain and pulled her tooth back to where it needed to be. The closest one at the time was 9 hours away, so it ended up being a distraction. But, there's more and more vet dentists all over the place, but they have to be done early if you're going to actually put those kind of movemented things on it. But most time it's just what we call interceptive orthodontia, and just get those things out of the mouth that are causing problems. Give them a comfortable bite.
Give them a comfortable bite. I like that.
Yeah.
That's a great way of thinking about it. Absolutely. Okay. as we close out here, can you let everybody know? So if you can let know, my gosh, I can't talk tonight. Where can folks find you if they want to learn more about Beyond the Crown?
They can go to btcveted.com. So beyondthecrownveted.com, but just shortened up. You can just type in Beyond the Crown Veterinary Education too. I will warn you to make sure you put veterinary education behind that.
Okay.
Because I did not realize when I came up with Beyond the Crown, there's a whole lot of beauty pageant stuff into it. Yeah, so it is, kind of a, oh, that should have thought about that before I went there, but I did not. And I'm just putting it, I know you aren't going to show this in the chat everywhere, but I just put my website in the chat there for you.
So fantastic. Okay.
Where we're at. But I come in and I have up to 10 hours of race-approved CE for doctors and technicians.
Okay,
and
that's fantastic. And you'll travel to different places,
I travel all over the country.
Yeah.
And I encourage the entire team to be present because, even though I'm a technician, I know the doctors are going to learn stuff. CSRs for at least part of it. They may not want to be there for all of it, but they can be there for some. One of the 4 hours is what I call the complete plan. And it's going to talk about, gaining compliance, reviewing anatomy and charting, common pathology, and the steps to a cleaning, or steps to a COHAT, and then a demonstration of all of those procedures. And then I have a 4-hour radiology positioning course, and then 2 hours of nerve block placement.
Nice. Okay.
So, for doctors and credentialed technicians on that one. So
yeah, that's very thorough. That would really set people up.
For the radiology part, I'm curious to know.
Yeah.
How we could be more efficient.
You feel like we could be more efficient in radiology?
Yeah.
And the radiographs of the mouth? Yeah. What do you think is the biggest
They just take so long.
You feel like it takes long?
It's a time suck for sure.
Yeah. And I think it's just first of all, knowing that you only have to have a diagnostic x-ray. You don't need a perfect x-ray. And that's where I want always the veterinarian there too, because, sometimes they have what they think is perfect and what's really diagnostic is not even close to what they want. Yeah. So, having them to understand what they need
that's a good point. Instantly, when she said that, I was like, some doctors might have something else to say.
That's exactly true though. I mean, the x-ray is supposed to be giving you a particular piece of information. Yeah. Do you know what I mean? So once you have that piece of information, it doesn't move on. Move on. Yeah. So now you've got ammunition. You can there you go.
And, so it's all those things. And it's just really, even the one on the, the part about the COHAT and it's really tips and tricks that I've done for years to make that procedure faster. I mean, I did this in research for years and we did, a crazy number of dogs each day, different type of cleaning than we do in the clinic, but just the things I learned there, I have incorporated into what I do in a hospital and a dental cleaning to really speed things up. And one of those is to reduce aerosolization. We have all that plaque and bacteria, and when we're using a power scaler, it aerosolizes in 6 feet and stays in the air 8 to 12 hours, all those kind of fun things. But, do what we do before we go to the dentist. And you remember those toothbrushes I talked about, right? You take that toothbrush and you wet it down and you just thoroughly brush all surfaces of the teeth after you've charted. And then power wash with your air water syringe, and it washes down about 80 to 90% of that plaque down the drain. And then all you have to go after with your scaler is the calculus that's still visible. Because plaque is easy to remove with the toothbrush, but is not very easy to remove with the power scaler. So those kinds of little things can actually speed the procedure up a lot.
Okay, it's good tips.
And then I save the toothbrush. I don't share toothbrushes with patients because that's just ewy. But I do. Technical words, ewy. I will put that toothbrush in like a little tiny cups of chlorhexidine. And then at the end of the procedure, I kind of wash it out, power wash it, and it goes in the goodie bag for the pet. So they get the toothbrush. So
I like that.
Something to try. I use it I grade for the VOHC all the time, and I grade plaque first with a disclosing solution. And then I brush it all off, rinse it, and grade calculus. So I know that works really well.
Okay. That's great to know.
Yeah.
Absolutely.
And a good thread of Tootsie Rolls with sprinkles and other stuff they maybe shouldn't have had for breakfast because they didn't.
Oh
Just
gosh,
saying.
that's so funny. That's right. Just saying. Exactly.
Yeah.
Well, listen, it's been an absolute pleasure having you on the Veterinary
Thank you.
Roundtable podcast. Thank you so much for joining us. I know how valuable your time is, and so we really
Thank you.
appreciate you spending some of it with us. And especially during Dental Month, it's pretty
Yes,
awesome
thank
that we
you so
got a hold of
much.
you and got this
Yeah.
accomplished this month with as busy
Well,
as you are.
I'm glad we were able to make this work tonight. I appreciate it so much. And
Absolutely.
I'll go recover from WBC like the rest of us still need to do
Exactly.
that. So,
All right,
all right.
everybody. Thank you so much
Okay.
for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.